Today is Wednesday, February 17th, and 2016. I'm still having trouble with that year. And I'm Mary McDonald, your hostess for the next half hour. And we have with us today Nell Gavino, our physical therapist, and also Trevor Stewart, who we're introducing is a part-time student intern. And they are in Garden Ridge. I said outpatient because it's here in my thing. And they are at Garden Ridge. You're working at Garden Ridge. And you're interning. Well, let's first. Where are you? How far along are you in physical therapy?
So I'm in my final year, my third year of physical therapy school, and I'm in my second full-time rotation. There's 3. So I'm in my second one right now, and I'm from Marymount University. So I graduate in May, and then I'll finish my last clinical in the summer and be done with it in August. So it's very close.
And you'll be full-fledged.
Right. I'll take my boards and then hopefully pass them the first time, and then I'll be ready to practice as a physical therapist.
Well, neat.
It's exciting.
And where are you from originally? You went from this area?
I'm actually from Roanoke, Virginia, so about 4 hours from here, 3.5 or so, and grew up there, went to undergraduate at Radford University, and then now I'm here just I came up to Arlington for school, so this is the first time up here. So.
Well, we're glad to have you.
Yeah, thank you.
And you're here for 7 weeks?
Yes, I'm
told
here
me.
at Green Spring for 7 weeks.
So is this your first time dealing with senior citizens?
This setting is my first time. I was in a different type of setting, outpatient orthopedics. So this one's been new to me. So over these 7 weeks, I've learned a ton, and like you said, different type of patient. So it's been pretty interesting for me to learn from Nell and from all the rest of the staff on the different approach to the different patients. So it's been really good for me so far.
We can be contrary, you know.
I hear people all the time tell me, "Oh, do you like dealing with the older population? What do you think?" It's been well to me so far.
Yeah. Well, no. We have our days.
Mm-hmm.
You know.
And most of it's from the patients. They're saying that you don't really like dealing with us, do you? It's pretty funny.
Oh, well, sometimes I just like making you feel bad. But you're hurting me. What have you found? What have you found at
the Garden Ridge?
I keep thinking Renaissance Garden because I go back to Renaissance Garden. What do you find most appealing or that you like dealing with best with senior citizens?
Well, I like the fact that everything is right here in one position. We don't have to go too far. I mean, everything is in this one general area, so you have all these different aspects of it. And then I like working with the older population because we'd actually talked about this yesterday, is that we feel like we're in control and we're able to see progress so quickly, and it's just rewarding to see how fast you can get somebody to like their prior level of function or even above. I mean, I'm seeing patients who come in who just had a fall and they're post-surgery and they're not able to do hardly anything, even sit at the side of the bed, and then by 2 weeks or a month they're up walking around doing things on their own. So it's just very rewarding in that aspect, and you don't see that in the other settings. So during these 7 weeks, I've seen so many patients, and I've already sent some of them home. They're able to do things on their own, so it's just rewarding. I really enjoy it.
Yeah, well, we're pretty determined, when you get this far in life. You're not going to hold me down. You lay there too long, you don't know what they're going to do with you, Yeah. No, I find when I was up there, I spent couple of times up there, so how do you feel about him now?
I think Trevor has done tremendous job and made really great improvements in terms of his skills as becoming a physical therapist. He had good rapport with the staff, the nurses, rehab team, and also the residents. You know, the residents love him. One of the residents called him son, my son. You know, so I think he blended well in the SNF area, skilled nursing facility, and we showed him skills that will make him, and that's the purpose of Green Spring, is to teach the students how to work in the skilled nursing facility, learn about Medicare guidelines, different diagnoses that we have, the behaviors, and just really how to deal with the geriatric population. So he's done really well. I'm proud of him.
Yeah, you seem to have a real nice personality for us. Yeah, it's and I think that's what we need. Yeah. We don't need an old grouch.
I think it's the challenge too is really learning the behaviors of the elderly population, and you know, when we are sick, you're not in the best mood, and knowing how to play around with that and accommodate to whatever, you know, changes that has happened to them, and he's done really well with that.
Have you come across some really difficult people?
I mean, I've run across some patients who are in a lot of pain, so it was difficult to do things, but nobody's been, you know, out of the ordinary, like rude or any sort of thing like that. But I mean, they've all been pretty nice to me, and they've taken me in as a student and let me work with them, so it's been great. I have no complaints, really. Everybody's been nice.
Wonderful. It's a place to come. So what do you see in your future? I mean,
so I have a little bit of time left in school, another clinical, but I've talked to Nell about this many times on how I really have enjoyed this setting, so you know, it might be in the future for me. I'm just keeping my options open, and there are so many settings in physical therapy, so it's nice to have those options, but it's just really, you know, buckling down and seeing which one I like the most, and that's going to be a decision I'll have to make, I guess, after once I finish, and just what's
well, you can
available.
always change too.
You can, because there's so many options. That's what's really nice about
Yeah.
that.
And how many grandparents can you have? And because we do adopt,
Exactly.
we do it. You know, we do adopt.
Mm-hmm.
You know, from yeah. You're so young. Yeah, you're cute.
Oh, thank you.
So, what kind of a family do you have at home?
So I've got a mom and dad, and then my sister lives down the street. So she is 32, and she has a younger boy and then a girl. They're 3 and almost 10. So they're keeping me busy whenever I go home. So it's always nice to see them. But my dad's side of the family, my great grandma lived to be 99. So got some good genes on that side of the family. So we'll see how that goes. But
Yeah.
doing well, living in Roanoke.
I have good genes. I knew all my great grandparents and great
Wow.
grand uncles and you know, whole slew going back.
Wow. So
So-
you have some good genes then.
Yeah, I know, but I've got all these pictures that I know the people, and I'm real guilty. I have written the names of them on the back of the pictures because I'm the matriarch now.
Mm-hmm.
I'm the lone one. But and it's kind of I don't know if I like it or not. You know, I don't have anybody my age in the family.
In the family.
Yeah, I see all these young people. But it's fun. It's fun when we get together.
That's
It's a
nice.
blast.
That's nice.
So we're almost. Our time is almost up. Is there anything you wanted to say now?
Just to wish Trevor well. He's finishing his affiliation this Friday, and he's moving on to doing some like volunteer work, right, in Costa Rica.
Costa Rica.
So they're going to do an immersion of doing field work there, so that's really great experience for him. And over in Green Spring, we do mentor students, and we have one lined up for the whole year, or a few lined up for the whole year. So knowing that Green Spring is a teaching facility, it's a good thing for our community to kind of advertise that we are open to having students come in and learn our skills in physical therapy, occupational therapy, and speech therapy over in Green Spring.
Yeah, well, that's good. But, well, our time is about up, and I want to wish you the best of luck in your future endeavor.
Thank you.
And I think you'll do great. They'll all love you.
Well, thank you. I sure hope so.
So, and I think and I thank you very much for coming and introducing
Thank you. Thank
Trevor
you.
to us.
Thank you.
We may want to keep him.
Sure. It's all up to him.
Okay, so we'll call it a day for you. I'm going to go on and try and get through the rest of it. I want to introduce the video, the 2016 talent show.